All right. After that exciting prize-winning event, I get the pleasure of introducing our next speaker. She's one of our favorite speakers at this course. Lindsay Orbeta is a registered dietitian. She has a master in of science in sports nutrition as well as exercise physiology. So I've actually known her for a long time, actually from her work as an exercise physiologist at UCSF. But now it's exciting that she's leading our women's health sports medicine clinic for the dietitians aspects of it. She is a consultant for the Oakland Roots, so if you guys are fans of them. And she also helps us in our Run Safe program, which you guys might hear a little bit about our running if you're going to stay to the end of the clinic. But she helps consult a lot of the runners there because she's got a great background in competitive sports. She was a collegiate swimmer herself and an Ironman athlete. So she's all mic'd up and ready to go. She's going to talk to you about recent advances in sports nutrition. Welcome, Lindsay.
Thank you. Okay. Everybody got one of these? Yeah, okay, great. I made them myself, so. Yeah, thanks for coming. So today, again, this is my topic, but my real topic is on the next slide, so I forgot I'm in control of that. Oh. I'm hitting the green button. Is that the wrong one? There we go. Okay. So this is kind of my real topic. It's still recent advances, but really I wanted to cover something that's very near and dear to me because I'm chronically injured from sports. And so it's great that I work in orthopedics. I try to curbside all the surgeons, but they're so busy I never get to ask questions. So I had to learn for myself about specific anabolic agents that are outside of protein, and more importantly, the ones that, I'm going to move one of these chairs over. The ones that help us build muscle when we're injured or after a joint or a soft tissue surgery. So kind of a little niche there is what I'm focused on today. And this is a photograph of me from last year when I had an ACL reconstruction surgery, not at UCSF, but it was still pretty fresh to me. And I really learned the term firsthand, catabolic crisis, if you've ever heard of that model. It's where we kind of have multiple periods of disuse in life that aggregate. And they come to this nadir point where you're like, wow, I'm in my late 40s and losing muscle is no joke. It goes so quick. If you've ever had any kind of accident or a fall, it's real. So I know it very intimately, and I wanted to talk about not only that, but anabolic resistance, which is of course one of the many joys associated with aging. And then we'll get into details of muscle atrophy, disuse, and finally, the three topics that we're going to focus on mostly, which is leucine, and then omega-3 fatty acids, and finally, colostrum as supplements. So hopefully interesting stuff today for you all. Button's not working. There we go. Okay. So how is muscle mass regulated? Well, simply put, it's kind of this dynamic equilibrium between fed and fasted states. So when we eat a meal, we replenish the amino acid pool that's being used and drawn from muscle in between meals. So proteins don't give us energy, but instead they go to regulate hair, skin, nails, enzymes, and of course the repair and recovery of tissues, and all that's going on when we're not eating. So this kind of restores that balance between two acronyms that I'll refer to on the slide repeatedly, MPS, muscle protein synthesis, and MPB, muscle protein breakdown. It's, again, the shift between those two that are in constant flux. And this is really a tightly regulated process, mostly with two hormones, insulin after a meal and cortisol, which is high every time we wake up. And really though, the heavy hitters in our diet that are going to stimulate muscle protein synthesis is more about, number one, a calorie surplus, eating enough, is really essential for building muscle. And number 2 is not only the type, but the quality and the timing of protein intake. And then finally, age, just how old we are, is a big driver of this process. So the main actor in hypertrophy signaling is mTOR, the mammalian target of rapamycin deep in the cell. And I talk about mTOR not only because I'm like secretly a nerd about it, but this is really the requisite for amino acids in our diet or for exercise to turn that process on. Until that gets stimulated, muscle building won't begin. Okay, so it's really regulated by diet and exercise. And in older adults, and by the way, unfortunately, older adults means 35 and up. Pretty sad, because that might be all of us in this room, except for a few of us. So again, like we're all older adults. So this is happening to all of us. And we all have this anabolic resistance that has started and is just kind of ramping up as we age. So that pathway, mTOR, is really inhibited in adults over 35. Okay, so the other reason I bring up mTOR is it's a nutrient sensor for one of the most anabolic branch chain amino acids. Raise your hand if you've heard of branch chain amino acids. Okay, can anyone tell me like what they know about them? Like what have you heard that they do or why they're great? Everyone knows like you're supposed to take them, but like why? No thoughts. Okay, yeah. Mm-hmm. Yes. Excellent. Yes. So that is in fact leucine, the only anabolic branch chain amino acid that we need to be concerned with, and we can get it in food. So again, quickly, leucine is the igniter of mTOR. That's what sparks, it turns on the trigger for muscle building. So think of it as the igniter switch. And leucine is really easy to get. We only need a 2.5 gram dose, and that's ideal about 45 minutes to an hour after training or exercise. And we can get that very easily in about 4 ounces of meat or fish, or we can get it in a cup of dairy like cottage cheese. Or you can buy the branched chain amino acids and you can take it that way too, just for an insurance policy. Okay, so we talked about mTOR, and lastly, one thing to know about branched chain amino acids is that they're different than other amino acids because 80% of them get into the bloodstream in direct proportion to your meal. So they just go right there and they're immediately metabolized, and that is why protein quality matters so much. So when we talk about protein quality, there's no debate that plant proteins are just not as bioavailable as animal-based proteins, and we're not going to go down that rabbit hole. We don't have time, but amino acid profile is what I'm referring to here. So that's protein quality, and that's where leucine really comes into play. All right, I wanted to leave you with this kind of consensus statement around protein needs from literature. So you can read this along with me. In older adults, MPS after a meal continues to rise with a dose of 35 to 40 grams of protein per meal. Even if there's no consensus for this optimal dose, it's clear that for those of us that are over 35, we need more protein than younger adults need. Okay, that's really like the takeaway here. And I want you to all to kind of just pick this up because there's a reason I gave it to you. On the back of this is a little reference chart that is in a font size so small you probably can't see it, but it is showing you where your protein needs are based on your age and how physically active you are. So this is great if you want to kind of have a reference point for patients that's literature-based and best practices. It's on the back. And go back quickly to the front. So this is a 37.5 gram dose. And the reason I made this onto a card is to kind of give people a visual of like, if you just ate protein, nothing else in a meal, which you don't, but if you did, this is a visual of how much is needed at a serving to get that dose. And it really like hits home when you see that. You're like, I'm nowhere near this. Most people aren't that are our age and that are active. So of course, I'm not suggesting that you call it a meal with just a 5-ounce steak. I'm just saying that that's how much you would need if you wanted to hit that 37 gram middle ground. And then of course you go and have vegetables and some whole grain with it. But this is just a good reference point. And it also shows shows you that, as an example, this vegetarian, the bean, avocado, and cheese, you need so much to get such less protein. So it's really like a volumetrics thing. But anyway, it's a nice little visual. So hopefully you can use that. Okay, so, again, regarding that timing, the anabolic window is really within 1 hour. Most research shows that it's within the hour following exercise. That's when blood flow to the muscle is greatest. And that's when you can really capitalize on absorbing more of the protein from a meal. So you want to be thinking about that as we're getting older, can I make sure I have a high protein snack or a meal within an hour of finishing my weight training? All right, that's the right window. Okay, so switching gears a little bit. I want to talk about muscle inactivity. So inactivity occurs slowly just by being sedentary or getting injured. And then of course it can be really rapid if we find ourselves with COVID or sick and in bed for a few days, and more so after something like a surgery. So a consistent feature of disuse atrophy, even short term, is a blunted rate of muscle protein synthesis. Okay. We know that it's how much we're building up, not how quickly we're breaking down. And this really points to why diet is a huge target of intervention for these scenarios. It's about attenuated muscle protein synthesis. That's what we're looking to really fix. So an example with this study showed really perhaps the earliest and most rapid declines in loss of muscle mass and strength to date. In just 4 days of knee immobilization, the loss of muscle and strength were primarily driven by impaired synthesis and really had to do with after eating. So again, there's that anabolic resistance that's coming back to haunt us, but it's just showing us that we need to think about what we're eating if we're hurt or we're getting out of a traumatic surgery. So what do we eat? Which is what we're here for. Fish. Raise your hand if you eat fish at least 5 times a week. One person. Okay, so one person. This is probably pretty similar to the American profile. 5 times a week is kind of where you need to be at to even look at the same amount that we need from supplementation. Okay, so we'll get into why, but fish is the thing I want to talk about most today, or more specifically, fish oil, omega-3 fatty acids. Okay, so the incredible benefits of omega-3s are still emerging, and we are finding that even international health organizations have a DRI, a daily recommended intake for how much of the 2 long-chain fats we should be eating. EPA, which is eicosapentaenoic acid, and DHA, docosahexaenoic acid, which I won't say anymore. Now, these fats are essential. We can't make them in our body. We have to be eating them in our diet, or we have to supplement with them. And I'm obviously a huge proponent of frontline, eat whole foods, but with fish, we'll find out it's a little trickier. So really, these fats support a number of processes in the body. It's cardiovascular health, vision and joint health. When you look at DHA, it's actually the most abundant fatty acid in the brain. And that's why pregnant women take it from the time we're a fetus all the way through adulthood. We benefit cognitively and with brain function from taking and eating enough DHA. And then EPA is really more about mediating prostaglandins, which are different inflammatory mediators that act like hormones. And when you think about how we lose muscle as we age, inflammation is underpinning that process. So that's why everyone knows about fish oil as an anti-inflammatory, right? Most people are yeah, that's what it does. But it does a lot more than that. So high-dose omega-3 supplementation is required for 2 full weeks at least to get the blood concentrations high enough that they reach this therapeutic ceiling. This is a huge reason why this data is only emerging now. It's because most studies looking at recomposition of a body for injured people or surgery, they're not using high enough doses and they're not taking it long enough. Finally, like the study design is getting more rigorous and they're really learning like what they have to do in a protocol to start to see evidence of change. So basically, you need 2 weeks, and how much you need depends on your current state of health. So you can look at the chart on the screen here, and it shows you that like the general recommendation is pretty low. It's only 2.5 grams a day. So looking at this chart, you can see that that 5 gram mark is what was shown way back in 1989 in the New England Journal of Medicine, which showed that's how much was needed each day to really suppress inflammation. 5 grams. And that's much higher than what we recommend across the board. But we'll find out next that 5 grams is actually what's needed to also improve body composition and strength. Okay, this is probably the most exciting study I want to talk about, and it really looked at the impact of omega-3s on muscle mass and strength in response to a period of disuse. And it was done on young women under 31, which is so rare to find in the research. I was like, I'm excited about this. So again, healthy women under 31 had one of their legs immobilized in a knee brace at a fixed position for just 2 weeks. And then they underwent a battery of testing, okay? First, they supplemented. So for 1 month prior, they took 5 grams a day of omega-3 fatty acids, and the control group was sunflower oil. Okay? And then secondly, they had a muscle biopsy, and the point of this was to look at isolated messenger RNA targets. The researchers wanted to find out, where are these amino acids getting packaged into proteins? Is it the muscle? Is it the gut? And they wanted to really drill down, so they also did an isotope protocol where they looked at how proteins were like kinetically changing over the course of the study. So they really thought of everything all the way through, and they wanted to be able to rule out like gut oxidation of protein and the turnover there, which can be a lot higher than muscle amino acid turnover. And then they had a DEXA scan for body composition. They tested their leg strength. And then more importantly, they controlled their diet 3 days before the study and all during mobilization. So in total, they took the supplementation for 6 weeks. And here's what they found. In both groups, it was known that immobilization of the leg definitely downregulated gene expression for muscle turnover, but muscle protein synthesis was significantly greater in the omega group at all time points. So that was the first finding. Secondly, and this is where I think it got really fascinating, and I want to remind you that muscle mass is how much is present, and muscle volume is how much muscle is how much space the muscle is taking up. And again, if that doesn't matter to you, I just remember like after the ACL, for months like exercising on a floor, doing leg lifts and being on crutches, and you just watch your quadricep vanish and your calf becomes like a baby calf. And you're like, wow, atrophy is so real. And so you learn about these things. And when I see them like actually changing with one supplement, I think it's pretty profound. Because again, if you've been through that, you know like how hard it is to bounce back from it. So looking at quadricep mass, the control group lost significant amounts, but the omega group had 0 change. And then only the omega group fully recovered their leg mass to baseline levels. Not only that, but the omega group lost only half as much cross-sectional area or volume, and there was a significant difference between that and control. An 8% loss of volume of the muscle versus 14%. And then finally, in looking at what immobilization did, of course it's going to reduce power and strength in both groups, but both groups did recover 100% of their strength. So there was no strength effect for omega-3 in this study, and that was actually surprising because former research has showed that it actually improves strength if there's a strength training protocol involved. So perhaps if they were immobilized longer than 2 weeks, we would have seen that effect. The takeaways here is that anabolic supplements can also now include omega-3s, and that's something that wasn't in the offering of this supplement prior. So we'll look at 2 other studies. This one was done in seniors and looked at, again, muscle protein synthesis. These were healthy but sedentary older people, and they were actually taking a drug that's made out of fish oil. Have you guys heard of Lavazza? Yes, I want to be on that drug because it's so much cheaper than taking the fish oil. So that's what they were taking, and it's actually the same dose that was approved by the FDA to lower plasma triglycerides. So again, this should be telling, like, it's the only food substance made into a pharmaceutical drug, I think. I'd be hard pressed to find another one, but it's really showing us like how impactful this is. So for 2 months, they took either corn oil as a control or 4 grams a day Lavazza, which, by the way, only ends up being 3.36 grams of omega-3. Okay, so they don't quite match up, but it's about 3.4 grams a day. And then they had an intravenous infusion of insulin and amino acids because they wanted to find out, like, let's give everybody the same thing to mimic a post-meal state, like post-meal absorption, what's going on in the body, and let's measure it. So the result was that omega-3s not only augmented the rate of muscle protein synthesis, but it attenuated anabolic resistance. It did both. And so importantly, this study showed that omega-3s should be considered an effective therapy in really treating sarcopenia, which is that functional loss of strength in older people or in people that have had multiple, like, fractures. So this was pretty profound because these results were in the absence of an exercise program. All they did is take Lavazza. They just took fish oil and they just hung around for a couple of weeks, and then they had all these incredible benefits. Alrighty, let's look at a similar study by the same researcher, and this was another RCT, again in healthy seniors, but this time they took Lavazza for half a year. And the result was that fish oil had clinically significant benefits on strength. It improved hand grip, upper and lower body 1 rep max, and it also increased their thigh muscle volume. So when you think about these results, you're like, okay, like, I kind of get it, but I needed to know, like, more profoundly how clinically relevant these results are. So the researchers said that it was equal or greater than that achieved with testosterone or growth hormone in older adults, which is pretty amazing. And then secondly, the difference in muscle volume between groups prevented 2 to 3 years of age-predicted loss in muscle mass and function. It's like giving 2 years back to someone's life. It's like putting youth in their body. So again, all told, I'm all about omega-3s. Whenever I get a referred patient from the surgeons and doctors in orthopedics, and I get the patient on the phone or I'm scheduled in front of them, I immediately say to them, are you taking fish oil? And if not, can we get you on high dose right now? It's something that I feel, it's, again, not standard practice, but I feel the research is showing us that it's such great benefit. And again, most people are already taking it. They're just not taking pharmaceutical grade or a high enough dose. They're taking like a Costco brand and swallowing 1 a night. And that doesn't do anything. We need to get to that ceiling effect. So, and I want to do a time check. How much time do I have? Do I have a timer? Okay. I'm not going to actually cover mechanisms too much. I'll quickly touch on it because they're actually really poorly understood. But I will say that EPA and DHA incorporate themselves into a cell membrane. And then from there, there's all of these signaling effects for cell proliferation and growth and making new proteins. And that's kind of the gist of it. And most of this happens through mTOR activation. So that's what's known. And I want to get to the next part, which is the biggest question I get from patients and people: why can't I just eat more fish? So the most popular fish that we're eating are actually super lean and really low in omega-3s. And I wanted to show this chart just to show that we're not even close to reaching the necessary levels in blood to get any effect. So we just found out what the doses are. It's 3.4 grams a day if we want a strength effect and if we're a senior. So if we're 65 or over, we're looking to improve strength, not being injured, just being a regular person, we need 3.4 grams a day. And for that, we'd have to consume 7 ounces a day of farm salmon. It's actually not that bad. That's like pretty doable. But when we look at that dose that's anti-catabolic, for people who are injured or post-op, it's 5 grams a day. 5 grams a day, no matter what our age, even if we're young. And to get that, we need to eat a pound of coho salmon every day. So like, who's gonna do that? I love salmon, but I have limits to the love. So I feel like there's no way that that's prudent advice. So again, that's where we start looking at supplements. And then lastly, there are issues when we consume larger fish, of course. A number of them, we don't have the time to go into, but basically mercury, heavy metals, those are found in the tinier fish that the bigger fish that have all these fats eat, like tuna, swordfish, etc. And then finally, there are a lot of issues with rancidity of the oil, that we actually take the fish oil and the gel cap. And then of course there's like purity and absorption and a number of other things. So the best thing that you can do is poke a hole in your fish oil with a pin and squeeze it out onto a plate and put it in the freezer. And if it gets foamy and it thickens and freezes like a thick substance and doesn't stay liquid, that is a good sign that it's not 1, pharmaceutical grade, and 2, pure omega-3 fatty acids. They're probably putting like vitamin D or other oils in there. So just like that's a quick test. You can also smell the oil. If it smells rancid, it probably is. So just 2 quick tests that you can do as a consumer. And then I knew that I'd get this question, and I do talk to patients about it, so I thought I'd put it here. These are the 2 fish oil brands that I highly recommend, and both are pharmaceutical grade, and they're in the right form, which is a whole nother thing we could like go sideways on, is the form. Ethyl esters or triglycerides are the like gold standard. So having it in that form is gonna guarantee you're getting it in the body. And again, these are different in price and in concentration. So that's why the Quell is cheaper and you have to take less of it to get the same dose. Okay, so those are the 2. And by the way, don't buy these on Amazon, please. It is a free market. It's unregulated. Nobody is a watchdog for supplements. In America, we have to be the watchdog. So when you look at these are the 2 that I say go right to the supplier. And there's a whole bunch of copycat websites even. Like instead of pure encapsulations, there's one called Pure Formulas. And so it's the same with anything. Just be mindful. You're putting a lot of money into the supplement, which they're expensive. You want to get the stuff that's like the real stuff. Okay. All right, so we're gonna wrap up now. Let me check the time. Okay, I think I'm good still. With bovine colostrum, of which there are 250 functional compounds found in, and 50 unique polypeptides, all of which are considered growth factors. And both human and cow colostrum are rich sources of many macro and micronutrients, protein, lactoferrin, and a number of bioactive compounds that are capable of treating different GI disorders, and especially IBS or recovery from a round of antibiotics. So I stepped on a sea urchin on a surf trip, and for 6 months I had urchin quills coming out of my foot. I was like a low-key surgeon, taking urchin quills out once a month. Finally, I was like, I need antibiotics. I took antibiotics and my GI was messed up, as it usually is with a broad spectrum drug. So I was looking for a way to treat that, and looking at colostrum was an incredible choice that wasn't drug-based. And I can tell you just from my own N of 1 that having colostrum post-antibiotic restored my bowel function within days. I was like, okay, I believe in this stuff. So that's not what we're looking at it for this purpose, but it is great for a round of antibiotics for people that are doing that. Okay, so in research, bovine colostrum has 100 to 1,000-fold the nutrition potential that human colostrum has. And even infants can take bovine colostrum and thrive quite well on it. And then supplementation has been shown in humans to significantly enhance IGF-1, insulin-like growth factor, which is an anabolic hormone, and also stimulate muscle protein synthesis, which is what we're talking all about today. So I wanted to give you a quick schematic. very involved. This is how it looks. All you need to know is that this is the brand that I tried, only because Instagram told me to try it. But again, Armra, this is the one that I'm seeing most commercially available. And this one is freeze dried. So when you look at the how it's made here, that's what it is. It's turned into a powder, and it's allegedly very bioavailable in this form. Okay, so I wanted to cover just one major study. This was from 2001, and I tried looking so hard to uncover a newer study on colostrum because this one was so promising. There's literally a huge hole in the research in the last decade or longer to find something that was compelling to present, but I did want to talk about this, and I hope that this means newer research is on its way. So this study looked at the effect of colostrum on body composition, strength, and endurance exercise. And these were young and healthy resistance-trained men and women, and they took 20 grams a day of bovine colostrum versus whey protein concentrate as a control. And this was for 2 months. And then they had a DEXA for body composition, and they got their 1 rep max tested and treadmill time to exhaustion. So first, for the results, there was 0 exercise effect. So you could just like throw that out. And then the weight group gained only water weight, but the colostrum group had a significant gain of 1.5 kilograms of bone-free lean body mass. And again, when you look at the error of margin for DEXA, it's only 1%. And so that actually was beyond that 1% error. So this was a real effect. And as for the mechanism, this is the part that threw me because there was no caloric surplus. These people were eating at their level for weight maintenance, and having a calorie surplus is a great way to build lean mass. It's not necessary, but it's important, and they weren't doing that. So the researchers think that there is some non-nutritive anabolic component to colostrum that was responsible for this. There is a major limitation of the study. That's that they didn't measure any of the anabolic hormones, so they don't really know the mechanism. They didn't look at IGF-1, insulin, and they didn't look at rates of MPS. So still some work to be done there. And because we are out of time, I'm going to quickly just say what these 2 studies found on colostrum. Again, they're older studies, one from 2014, but the first one showed significant increases in leg strength, looking at colostrum versus whey protein. And then the second study showed that colostrum increased 1 rep max bicep curl significantly, and it was found to be as good as whey protein or better. So still some areas, like I said, to go and jump off of, but yeah, I think just in general, there's a lot of health benefits that we could look at for bovine colostrum. So that is all I have today. Thank you guys for listening. Yes.
I don't know if this is anecdotal, but I know I don't tolerate omega-3 pills because of GERD, and I have patients that are doing it for like dry eye syndrome, and they just can't keep them down because they give them so much nausea and GERD. Do you feel like the ones that you recommended don't cause that as much?
So there are 2 things that I thought of there. So omega-3s have a slight laxative effect. So that's another thing to look out for, especially at doses above 2.5 grams. So one thing to know is you either have a really great bowel movement after you start taking them, or it can go south. So you want to ramp slowly over the course of a week. As far as GERD, I know about fish burps. Fish burps is something that's common. That's not the same as GERD, but it could exacerbate that reflux. So low dose to start and then slowly ramping to tolerate. Or if they just can't tolerate at all, well, having with a meal that has fat in it can help absorption. That's the second thing. And then finally, they can look at, even though it's not as effective, flaxseed, ground flaxseed, which has omega-3 fatty acids from plants, but the conversion is nowhere near fish oil, the conversion of the long chain fat from plant to the EPA and DHA. But it's something that they could take that is full of fiber and still heart healthy. So yeah, but that's my only kind of thoughts on that. Yeah. Oh, the protein cards? I don't know. They were making their way around the room, but I'm not sure. They might be at the front or the back. Yes. Dr. Luke, did you want 15 minutes? Oh, okay. I didn't realize that. Okay, good.
Do you have any recommendations on ways to mitigate muscle loss with GLP-1 drugs?
So these are brand new drugs, and I am not an expert on them. What I talk about with patients who are taking them is the importance of protein, one. So that's important for all of us, regardless of being on a GLP or not. So making sure that we are getting that 35 to 40 gram dose, which again is really tricky for a lot of people. So I work with them about what are they having at their actual meals and how can they supplement to get to that target. So that's kind of the first line of defense. Secondly, I know that GLP-1s tend to really suppress people's appetite, right? That's kind of the mechanism for how they work. So when you go and tell somebody who has no appetite to go eat more protein, oh man, like it obliterates their appetite. Then they're really not hungry at all for hours. So a big strategy is to space out high protein meals or snacks throughout the day. And sometimes it looks like a high protein smoothie, right? So like Greek yogurt with like peanut butter and whey protein isolate and like maybe a frozen avocado and cocoa powder and banana. Really high calorie, high nutrient dense protein smoothie could be like a good strategy every day. I talked to them about adding whey protein isolate to soups, oatmeal, like in coffee, in black coffee, it's tasteless. So all of those are just kind of different ways to adjunct and get more protein in. But that's kind of like the extent of what I talk to people about with that is how is their appetite? How can we space out the calories? And how can we make sure that they're in nitrogen balance, that they're getting enough for their needs? Yeah. Mm-hmm. Yeah.
Since Orthopaedic is primarily prescribed for elevated triglyceride, is there any study documenting what you're teaching us about protein for strength and performance?
Is there any study that for Lavazza? Besides the two that we talked about today? Those were looking at strength and muscle protein synthesis? For Lavazza, correct. Oh, yeah. They just happened to use Lavazza because it was a controlled way of getting the same dose of that omega-3 fatty acids. Yeah. Yes. Cholesterol, I don't know the effect of colostrum on lipids. It is a good source of fat. It's very high in polyunsaturated omega-3 and 9. It does have some omega-6. I don't know. I don't know the answer, but it would be worthwhile to look into. Yeah. Yes.
For the post-operative patient, I've heard recommendations suggesting like collagen peptides to do that. What are your thoughts on those?
Collagen, I don't know anything about. I did ask my boss, Dr. Edwards, once because I'm hurt all the time. I was like, can I take collagen for soft tissue? And I think her response was, if collagen worked, we'd all be out of a job. So that's what I remember. I was like, oh, okay, so I could just like throw it in the trash. She's like, I mean, take them, but I don't know the evidence behind it, and I don't know if it's strong or not. Yeah. Colostrum is different, but yeah, collagen, I don't know. Yeah. Yes.
Any supplements that would be like safe and recommended in adolescents, either like athletes and people muscle or kids under 3?
Yeah, so fish oil is something that's safe across the lifespan, and that's why like it's even safe for a fetus to receive omega-3 fatty acids. So like I know when I was pregnant with my 11-year-old son, I took high-dose fish oil. I was so glad I did. Just because it's really regulating fetal brain development. So it's incredibly healthy and safe. The dose is a different story. The dose is, I think, it's relative off of body weight for kids. So you don't want to go give them this like mega dose, and I don't know what the safe dose is. So I'm sorry, I don't know, but yeah, it's across a lifespan. And you could see like on that one slide for dementia and cognitive decline, which would be like Parkinson's and Alzheimer's, the dose was crazy high. It was like above 10 grams a day to be considered therapeutic. So yeah, the dose goes crazy high. Colostrum, so because I saw in the studies and the review studies that infants can thrive who can't accept human colostrum or have allergies. They can take bovine colostrum and do quite well. So my assumption is that if infants can take it, it's probably fine for kids. This is not a supplement that they were using in the study. So I can't go and say it blanket, sure, any kid, at any age can take this armor. I don't know. But in general, colostrum was safe for these infants when they needed it as a formula. Yeah. Yes. Yeah, I have a lot of comments on creatine. I didn't talk about it because it's so obvious. Like everybody's taking the white powder. So creatine is something that is like in my post-surgical note to all patients to be taking. Creatine monohydrate is one of the longest studied and safest and most effective supplements for maintaining muscle mass and muscle bioenergetics that we know of. So with that being said, I want to say that it's above 16, as long as the teen or the adolescent is healthy. 16 and up is safe to take colostrum, creatine, and there's a loading dose. So there's a loading phase that's required of 20 grams for the first week, split up into 4 doses of 5 grams a day, or 5 grams per meal. And then after a week, it drops down to a maintenance dose of 5 grams of creatine a day. And yes, there's a ton of evidence to support that it's fantastic during times of injury, pre and post-op, and for people who are going through perimenopause, there are a number of applications. Yeah, and it's tasteless and affordable. So yes, it's great. And sorry, last thing on that, you want to be taking it within 1 hour of exercise. That's like the anabolic window.
In 1 hour.
Either
side. Yeah. Did you have a question?
I was just wondering if you have people that take both the creatine and the fatty, like the omega-3.
Creatine and omega-3, yes. So in the post-op nutrition note, both are there. They're taking them at the same time. Were you curious about like maybe interactions or? Oh, okay. Yeah, both. Yeah, definitely. I recommend both. Yes.
It's kind of the comment you made about the loading dose. I've heard some people say that it's like super important. Other people say that it doesn't matter. Like
the loading. Yeah, I don't truly know. I mean, you'd have to look at like blood concentrations and do like a tracer study to see, and I didn't look at any of those, but I also didn't do the loading phase. So, and yeah, I don't know. But I did take it before and after my ACL surgery, and I swear it was like pretty instrumental in my recovery. Yeah, I really felt it helped me maintain muscle. Yes.
So for the maintenance of the muscle, do you need to have any form of exercise, like to maintain, or you just diet and that's it?
Yeah. So Dr. Luke asked the question of, in thinking about muscle maintenance, and I'm assuming you mean like over a lifespan, over aging.
Even after surgery or something like that.
Yeah. So in terms of like anabolic processes, right? We know that mTOR is stimulated by 2 things: physical activity, contraction of the muscle, and amino acids in enough of a dose and enough doses spread throughout the day. So those 3 things are like the gold standard that would optimize muscle building, right? Now, if you take someone who is not exercising, but they're still taking the omega-3 in the right dose, then what we just saw today is evidence that there's still an anabolic effect. So that is, to me, what was so incredible is like, even if you take someone and they're just not going to do the physical therapy for whatever reason, like lack of motivation or they're in too much pain, the omega-3s were still showing significant effects, clinical significant effects, right? So is it necessary? I mean, I don't want to go that far to say no. I don't know. But it sure does seem like if you want to give yourself the best chance at recovery and reduce catabolism, then you want to be doing the physical therapy on top of the protein and some of these supplements, yeah.
Any thoughts on possible association between omega-3 supplementation and atrial fibrillation?
I'm sorry, repeat, you said about between?
Atrial fibrillation and omega-3.
Oh gosh, I don't know anything about that. Yeah.
The American Heart Association about 5 years ago
Mm-hmm.
did a meta-analysis of people on omega-3 supplements, and they had wasn't necessarily caused, but they
Yeah.
correlation.
Oh, wow.
Whereas they didn't see that with people who ate a lot of fish.
Huh. I just know that obviously there's a ton of cardiovascular benefits to omega-3s, and specifically on people with high plasma triglycerides. But beyond that, I don't know. Yeah, especially when it comes to like AFib. But yeah, something to look into for sure. Yeah. Any other burning questions? Yes. I'm so sorry, I could barely hear you. Did you say algae sources of? Oh, are you talking about like phytoplankton and what's the other one? Oh, blue-green algae. Is that what you're talking about? Oh. I don't know what that, or I can't hear you. It's one of the two.
Seems like a vegan option.
Vegan option. Right. Okay, so one vegan option I mentioned earlier is, and it's not the same. The concentration and the conversion rate is not the same, but it's ground flaxseed. And that's because alpha-linoleic and alpha-linoleic acid, they're not the same. They have to convert. So they don't quite turn in the long chain EPA and DHA. It's not the same metabolically, but it's still a way to get omega-3. Another source is walnuts and walnut butter. So a lot of people forget, like, walnuts is the best nut in terms of anti-inflammatory properties. So ground flaxseed, you could take a tablespoon of that in 16 ounces of water every night. And by the way, that's something you could do for like a lifetime. And all it does is increase soluble fiber, and it has heart health benefits. So it's great anyway to be doing. And yeah, and walnuts, those are the two best. Yeah, all seeds and nuts are great, but those are the best. Yeah. So that's what I would tell a vegan to do. Yeah. Okay, everybody, is that it? Yes. Okay, thank you for your time today. I appreciate it.